Well, I'm now joined by Alan Price, who's the CEO of BrightHR. That's a support service for small business owners. Thanks for joining us, Alan, this morning. Now, first of all, legally, where does the NHS stand on forcing staff to get vaccinated?
Following the government announcement, it looks like we'll have enabling legislation coming in very shortly, which by April, all frontline NHS workers, and more wider than that, anyone working in a CQC regulated environment who are working with service users or patients will need to be vaccinated.
Now, we've just been hearing from the Care Association, and we've heard from NHS bosses as well, who talk about there being a recruitment crisis and fearing that actually, as a result of this, we're going to end up with understaffed services during what's going to be a difficult winter. So what could the impact of this be?
We've spoken to thousands of care homes that we give advice to on a daily basis, and we're going to have the same impact in the NHS and domiciliary care sector. And what we're seeing is an element of redeployment, but what we're also seeing is a large education piece. A lot of care home workers, a lot of NHS workers have chosen to be not vaccinated due to a lack of awareness or education, or even an uneasiness about sickness pay and what will happen to them if there's any complications arising from the vaccination. So therefore, what we're seeing is a big call for education, not just in the social care sector, but also in homes as well.
But don't you think this education could have come about earlier? I mean, we've had the vaccinations around for the best part of a year. Why wait till it's already gotten to this stage?
I think from our perspective, it's private employers and small business owners who are having to provide that education piece to the end employee themselves. We don't see a national programme in terms of employee awareness of what the vaccination means, and also any guidance with regards to employee pay. From the small businesses that we're speaking to, we're advising them to not only pay the employee to attend the vaccination, but any complications arising from it, to pay them full pay. That's a lot more cost effective than the recruitment challenge that we're currently facing across the UK.
Alan, thank you for your time this morning. That's Alan Price, CEO of BrightHR.